My name is Janessa Kropp. This is my presentation for FNP-597 with Professor Amber Swartz. This week my SOAP note was my second women's health SOAP note, and my preceptors on this rotation were amazing. So I was super grateful, but we saw a patient, MD, who is a 37-year-old Caucasian female, date of birth 10/6/1986. She presented to the clinic alone. She was a really good historian. She was in scrubs, but she worked as a veterinary technician, which was nice because she had some bit of health education and knowledge for a chief complaint of irregular bleeding. So she states that the bleeding has been constant from November till present, which this week is July. So she has had one really good break, which she was on right now. She hadn't been bleeding for 6 days, but that was her longest break of no bleeding since November. She has no children, no desire to have them in the future. She does report, I went to the patient first prior to my preceptor to kind of get a history and see what was going on, and she was very tearful, very emotional, stating that we live in Utah and she had gone to California to get a medical abortion, which she took, I believe it was misoprostol, twice, and had a medical abortion in October, which then caused her to get on birth control in November. And that's kind of when all of her bleeding started and has continued till now. She hasn't sought out medical care because she was so concerned about the bias of the provider and opening up. So as a student, she opened up to me right away, which was really sweet, and I feel like we really built that provider-patient relationship really, really fast. She was very hesitant and took a long time for her to agree for me to be able to tell my preceptor to give him the whole health picture. After a lot of education of why it's important and why it could be important for him to know as her medical provider, because I'm going to be gone in her future visits, and he needed to know a full health history, but she was so concerned about that, which made this just a difficult case, and it took a lot of time and a lot of education and a lot of communication for me to build that relationship with her, which eventually she really opened up to me fast, but she didn't want it to go elsewhere, which at the time was important. So there was no complications or anything post-medical abortion. She said she's typically a regular bleeder, but she just hasn't been regular since about her 20s, so about 15-ish years plus. She did state the color of the blood can change from reds to more browns throughout the month, but it's just constant. There's no pain, there's no accompanying symptoms. She's currently sexually active with one partner. They live together. Clinical diagnoses, the patient does have a diagnosis of clinical depression, which she treats with Lexapro and notes is doing well. The patient had no ovarian cyst drainage in 2013 with no associated complications with the surgery or anesthesia. There's no medication, seasonal, or food allergies for this patient. She's currently taking Lexapro 20 milligrams by mouth once daily for her anxiety and depression, and then birth control that she started in November was Saida 3-0.03 milligrams tablet once daily by mouth, which is a really, really low dose birth control, which she's aware of. She's had all of her vaccinations. She stays up to date on her flu and COVIDs. There's no significant family history. She has one partner, which she lives with. She works as a veterinary technician. Her partner works in construction. They're both working full-time. She reports a desire to work out and eat healthier, but hasn't found the motivation to do so, especially with the bleeding. She said that's not the last thing she wants to do. She reports a sedentary lifestyle outside of work with little to no physical movement, but reports being active at work. She sleeps about 8 hours a night, feels rested after her sleep. She does wear her seatbelt, and all firearms within the home are in a safe that's code encrypted that only her and her partner know the codes to. She reports being non-religious and just does not identify with a specific church or belief. Her review of systems, she does report weight gain, negative fever, and fatigue. She doesn't think the weight gain is associated with her other symptoms. She just feels like she's become more sedentary and therefore has put on a little bit of weight. No swelling, chest pain, or cyanosis or tachycardia on board for the patient. Patient also denies shortness of breath, cough, excess sputum. Reproductive, she reports continuous bleeding from November to July with minimal days of no bleeding. Denies cramping, pain, other substances besides the blood, negative odors, and no other reported symptoms. All of her vital signs at the day of the visit were good, besides her weight was 230 with a height of 69 inches, so a BMI of 33.23, which is high. So we did a lot of education on that and the other health benefits that could bring, even if it's not associated with her health complications and chief complaint at the date of her visit. She's in no distress. She was well nourished, well developed, dressed appropriately for the weather. Negative edema, cyanosis, or palpitations. S1, S2 audible with no murmurs or gallops. No clubbing, no observed respiratory distress or accessory muscle use. All lung sounds were auscultated clear with no rhonchi or crackles. Her gynecological examination on the external genitalia was completely normal. No erythema, no lacerations, no genetic abnormalities. Her cervix was a slight erythematous with no lesions. Everything looked good. Upon examination of that, we did collect a pap smear. Her last one was 12/1/21, so she was due. So we collected a pap smear after we inspected. She wasn't bleeding at today's visit, which was good. It gave us good visibility. There was no discharges, odors, or lesions seen on examination. So her assessments, number 1 would be dysfunctional uterine bleeding. ICD-10 is N93.8. Screening for cervical cancer, Z12.4. And then encounter for gynecological examination, Z01.419. So diagnosis, we did obtain a CBC, a TSH with reflex to T3 and T4, as well as her pap smear, which will help us kind of identify if anything else is going on. The patient started her birth control, Saida, in October after her medical abortion, and then her bleeding started in November. She hasn't taken a break from the pill, and her bleeding has been continuous since then. So we did decide that was the most likely cause of this elongated bleeding period. Bleeding for 8 months, and so we're going to be discontinuing the Saida and starting a new birth control. Both the patient and the provider agreed that this is the best choice of action. The patient had done Ocella years before and wanted to go back to that one, so that's why we chose that one. So it has 21 active tablets with 7 placebo pills, and she's going to be discontinuing the Saida while still being protected, so against pregnancy. Education was given to the patient that those low-dose oral contraceptives can give undesirable effects like excess bleeding. So this is really going to be easy to diagnose if that's what is going on. If not, we'll have to deep dive a little further. Education was also provided about other types of birth control. She came in kind of hot, saying that she wanted a hysterectomy, double oophorectomy, and salpingectomy. We educated her against this due to her age. She just states that she never wants children and just kind of wanted to get it all out so she could stop the bleeding. So we kind of talked her down into maybe trying some other routes first before undergoing unnecessary surgery. She was also educated on IUDs, birth control patch, and vaginal rings to see if maybe at a future visit she'd like to branch into one of those. But where the Ocella was previously successful, we think we'll find the same result. The patient's going to come back in 2 months to report back if there's improvement, stagnation, or worsening of the dysfunctional bleeding. Patient's agreed and is on board with all aspects of the treatment plan, but this was a very educational one for me on the different types of birth controls, as well as a patient being able to confide in me as a student and not wanting it to go to my preceptor. This was a really educational patient and one that I will definitely reflect on later in my career.